everyone. Okay, finally, I'm a little bit late because I'm trying to figure out my connection on Facebook because I'm going live right now on both my Facebook page and also on my Instagram. So, okay, I hope the Facebook is okay. And I'm not sure what happened today. Facebook giving me a hard time to start this live event, but I figured it out. So, all right. So today, oh, hi. Actually, I should introduce myself first. I'm Anna Tai. I'm the owner of this page and the account Anna the dietitian. Well, obviously, I'm a dietitian. And today is our very first episode of this heart to heart roundtable talk. And I decided to start doing this because I just want to be able to interact with my followers more. So in the future, if you have any questions, anything that you want me to answer, put it in the comment, put it in the Facebook page or message me on Instagram. But since this is my first episode, I'm not gonna be doing a lot of like very specific thing, but I think it's just appropriate for me to talk about how who I am, why I started this, and just give you a better idea of who I am and why you want to listen to me and all of that stuff. So, sorry, the weather has allergies, so all right. Anyway, so like I said, my name is Anna Tai. I'm a registered dietitian and I'm also a board certified specialist in pediatric nutrition. So I basically, my background is working with children with a lot of special needs, rare genetic disorders, and things like that. And I'm also actually studying to become a hypnotherapist. It's a long story and it's fun. And I'm actually almost done. Um, but we'll talk about how I get into functional nutrition and also hypnotherapy. And it's like once you listen to my story, you'll understand why. Like, what was this nutritionist dietitian doing with hypnotherapy? Okay, so like I said, my background is in pediatric nutrition. So I work with a lot of children with special needs and rare genetic disorder. And and for most people think that, oh yeah, like nutrition with kids or kids is like little mini adults. And I always have to correct people. Children are not mini adults. You cannot just take whatever recommendations from adults and then bump it down a notch and give that same recommendation to kids. Kids are still human beings, but their needs are different. Kids needs to be on a special high fat diet when they're born, and there should be no restriction or anything. But anyway, so because of that unique background of mine, there's a there's not a lot of nutrition or medical protocol for children as in adults, right? Like in adults, it's like, oh, you need to lose weight, cut back on calories, exercise like crazy. You have heart disease, you eat a heart healthy diet, or you have diabetes, follow diabetes diet. There's no such thing in children. Everything with children is based on the function. So, and actually, it's only recently that I realized that I'm actually have been practicing functional nutrition most of my most of my entire career because everything that I learned. Oh, and by the way, when I start um, my practice as a pediatric nutritionist, there's no pediatric dietitian around to teach me anything. I'm I'm basically the first pediatric dietitian in the hospital, so I have to learn everything. So I found every book that talks about pediatric nutrition. I just read everything, like even books that thick. I read everything back to back. So I pretty much learned about pediatric nutrition on my own. And over the years, seeing all these kids with special needs, like I said, a lot of these um, kids medical and condition, there are no protocol. So I have to come up with things, right? So that means that I have to learn about different organs, how every organs work. And with kids, unlike with adults, That gave me actually the opportunity to work with a lot of pediatric specialists. I work with the neurologists, pediatric neurologists. Okay, I'll just go from different organs. I work with the pediatric neurologist, pediatric cardiologist, pediatric gastroenterologist. Um, what else? Oh, pulmonologist. Did I say that? Pediatric pulmonologist. So a lot of times, like the way that we treat patients at a hospital is we do a team approach. So all the specialists together all sit in the same room. Oh, I also work with the pharmacist very closely as well. So we all sit in the same room and we watch. We we kind of go over the patient's list and then we all look at the patients together, but from a each of our specialties perspective, and then come up with a treatment plan. So I learned from my career as a pediatric nutrition that when we treat the person, we treat from all angles. Like when a patient comes to me, I don't just look at their diet. I always go over the whole symptom list, like any other symptoms that they have. So that gives me a unique background when it comes to helping people to get better. Is like I look at the overall health and everything because I understand that okay, when a child have problems with the brain, depending on what kind of issues they have. Like I have kids who are completely vegetative state. So when their brain is in a vegetative state, the metabolism is a lot lower. So I don't give them as much calories as another 2-year old do. Or if the child have like heart problems, because heart is actually a very highly metabolic piece of muscle. So when they have heart problem, the metabolism goes up. So I understand that okay, kids with heart problems will have a higher metabolism. Or kids with GI symptoms. What kind of GI symptoms? Any kind of GI symptoms could mean some kind of malabsorptive symptoms or some kind of food intolerance and things like that. Or lungs. Like people don't realize how lungs can affect like metabolism and things like that because your lungs, if you look at it, your lungs occupy almost half of your torso. So in a child who have a lot of lung issue, we we have to look at how much calories they're burning because if say a child is coughing a lot, that's like a workout in itself. So the metabolism is higher in that. So so that trains me that my training comes from the fact that I need to look at the whole person as a whole, each organ, which organ's not working, which organ's working better, not working so well. If the gut is compromised, like sometimes some children will have condition where a lot of the intestine have to be taken out. So I need to find out which part of the intestine is taken out because nutrients are absorbed at different location in the intestine. So my thinking process always go back to what's left of the function or what is left in the function left in the patient. So a few years ago, so this is the story where it comes to how I get into where I'm doing with um, with the Anti-Wellness Institute. So a few years ago, I started seeing adult patients because they hire another pediatric dietitian out at Schofield Barracks. So she's taking a bunch of the other kids. So I have a lot of openings from my side. So they start asking me to start seeing some of the adult patients because there are just so many people trying to lose weight, struggling with weight, right? So I was like, okay, that's fine. Just give me all the overweight one because I was like, that's the easiest one, right, for someone who don't usually see adult. Because I don't, I was like, okay, I have no idea about all the adult diabetes drugs. Because as a pediatric nutritionist, I only see mostly type 1 diabetes because that's what kids usually have is type 1 diabetes. Very, very seldom do I see a type 2 diabetes. So I was like, I don't know the medication. So give me only your overweight patient for me. So I start seeing a lot of women coming to me for weight problems. So I was like, oh yeah, this will be a piece of cake, right? Because with with my patients, my pediatric patients, I always able to help them. Like if the kids needs to gain weight to catch up weight gain and all of those, I'm always able to do that. So I was like, oh yeah, with the adult will be fine. So I start seeing a lot of women. It's a lot of women and maybe a few men too. But what I've noticed is like, so I just do the same thing, right? Like what we're taught in nutrition school. Oh, you need to lose weight. Let's cut back on calories. So like cut out 500 calories per day to achieve 1 pound of weight loss a week, right? So I'm pretty sure most of you have heard of that bullshit many times. So that's the bullshit that I was dishing out. And make sure you exercise every day so you create that deficit. So you cut back 500 calories intake and then exercise more to dip it further down. And then after a while, I realized that that recommendation doesn't work. And I also start getting a lot of referral from doctors like, hey, can you see this patient? Because she tried everything. Like she tried dieting, she exercised every day, and then I even see women like they're just so desperate to lose weight, so they put themselves on like a 1,200 or 1,000 calories diet and then work out 2 hours every day. And I was like, so I get the whole history and everything, and then I was like, I don't get it. Like I know she's not lying to me. And then on the other hand, I'm seeing a few men who's trying to lose weight, and I give them the same advice, and then the man will lose weight, right? So I was like, this is so strange, and it's the same with the women too. So I tell the woman, okay, you do this, and that, and usually they'll have a husband who do the same thing. A very supportive husband. They might lose like a few pounds, like 1 or 2 pounds, if any weight loss. But then they're like, but my husband doing exactly the same thing, lost like 10 pounds in a month. So I start thinking, like, why is this so strange? Like, so the recommendation that I give to the women doesn't work. Like the recommendation, the conventional weight loss recommendation of cutting calories, going on calorie deficit, does not work in women, but then it worked in men. So I was like, okay, there's something not right here, right? So then, and then after seeing a bunch of patients, and then there are a couple of patients that came, and then I find out, realize that they have a lot of like GI symptoms and skin conditions. I start asking more questions. So then with a few of the patients, I start taking out food. So I treat them more like my kids' patient, right? So now I was like, okay, I need to start dipping deeper rather than just giving them that conventional weight loss diet and exercise plan. So I start asking more questions like how I normally would with all my kids, like all the other symptoms, like any GI symptoms, any skin issues, pain, things like that, right? And then a few of them, I realized that they were having, so all of us women have that weight fluctuation with around the period time. So that's definitely a hormonal thing. And then like a lot of these other women also have like food intolerances. So start telling me things like, oh, I cannot eat red meat. Every time I eat red meat, it tears up my stomach. Or this other woman would say something like, oh, I'm allergic to almond, but I still eat it anyway. So I start to realize that there's a lot of food intolerance that um, people ignored. So then I put them on a special diet where it takes out some of the food that I know they're sensitive to. And then when they come back, they start losing weight. So I start looking into more of the more alternative medicine, not so much alternative medicine, but trying to understand the weight. So I start doing a lot of research, looking into weight loss in women and things like that. Then and then also from my experience with working with these women, I realized that the cause of weight gain in women have nothing to do with calories at all. Like this whole calorie concept is all just bogus bullshit. So you'll see that in a lot of my posts that I kind of talk against it. So what I realized is a lot of women actually the true underlying cause for a lot of these women weight gain issue is their digestive issue. And I'm probably not going to dig deep into each of this, but they have problems with digestions, problem with immunity. Some of that weight gain is caused by inflammation and hormonal imbalance, right? So these are the things that I discover is that these are the real underlying cause. So going back with my pediatric nutrition brain, I was like, okay, so we have digestion issue, we have hormonal issue, we have inflammation, and then we also have hormonal imbalance. So then the solution will be fix the food choices. We can also do enzymes, do probiotics to fix the digestions. Um, and then hormonal imbalance is we need to look at what they're eating that is interrupting with the hormones. And then inflammation, what kind of food that can help reduce inflammation. So we do the anti-inflammatory diet. And then food sensitivity. We need to figure out what food they're sensitive to. So I kind of figure out all that, right? Like, okay, so now I find out what the problem is now. So I can figure out the diet that fits that. And that's what I did. So I found this diet. I sort of discovered the autoimmune diet that helps with this. So then I start having my patient telling them, okay, follow this diet, come back to see me in a month, which is amazing, right? Like I start seeing my patient lose weight, like even the ones who said, I've tried everything under the sun. I tried this, and that, right? So they all come back with weight loss. It's like crazy. Like with this diet, some of my patients easily lose like 10 pounds in the first week. But I can tell you it's not all body fat, it's a lot of water weight from inflammation. So they come back and was losing weight and like everyone's happy. I was like, oh my God, finally something that works, right? But then something happens. Usually like maybe a month, 2 months, or 3 months later, every one of them always something comes up and then flip them back to what they were doing before. They regain all that weight back and they stop coming because they feel so ashamed. They're like, oh my God, I was doing so well and then I screwed it up. So so then I was like, oh my God, I finally found a diet that works and then but I cannot keep them on it for as long as possible. The most was like 3 months. Always something happens. My husband's schedule changed, my husband got deployed, my kids' schedule changed, they suddenly have all this sports thing, or I got sick from cleaning the house and things like that. Just something always happens that somehow sabotage the whole effort. Like they're all loving it, right? Like they're like, oh my God, I just love this diet. I can eat anything, almost anything I want. I don't feel like I'm starving. I have so much more energy while I'm losing weight. And I don't even have to exercise every day. So they were loving it, but then I was like, then how come you don't want to continue doing it? Why is that like why is it just a small change in your husband's schedule? You have to flip back to what you were eating completely. So that's when I start looking into other things. I keep looking, and then one day I saw this interview on YouTube. Is an interview of Marisa Peer. So I'm kind of like personally, I'm into personal development and self-help type of things because that's another story that I can talk about myself. So so I saw this interview, and I actually have read about her before, but at that moment, I think my mind wasn't in that same wavelength. But this time, when I listened to her interview again, I was like, oh my God, that's what my patient is. And what she talks about is like, so a little bit introduction of who Marisa Peer is, and I probably should tag her in here. Um, she's actually a hypnotherapist, and what she does is her job is amazing. She helps people with like all kinds of illness, problems, habit, addiction, and everything. And she does it with hypnotherapy. So at first, I don't really understand what hypnotherapy is, but what really catch me is when she talks about the body mind connection. That's really the the part that caught me the most. And then I start listening to her more about how hypnotherapy can help change the underlying belief and mindset. So, so I was listening to her talking about how the mind can affect the body and can either heal the body or our thinking can actually cause our body pain and suffering. And this is how the mind and body connection, I'll try to explain in super fast and simple, easy to understand way. So basically, any kind of stress So a lot of times when we think about trauma, we often think about someone coming back from war, or someone who have witnessed some traumatic events, like the parents being killed, or someone who's been abused, physically and emotionally or sexually abused as a child. So those are the normal kind of trauma we're thinking about when we think of the word trauma. But then there's other kind of not so obvious trauma, like being neglected as a child, or like being neglected, not feeling that they're hurt, like all these other very minor things that happens in a child's life that causes stress, or even as adult, like regular stress, like getting stuck in traffic, being in a job that we hate, being in an abusive relationship, not feeling like we can speak up. All of those stress can actually, so all that are emotional or thinking but kind of stress, right? So when we have stress, whether it's physical or emotional, that actually affects our nervous system. So when our nervous system is stimulated or regularly stimulated, in a sense of like our own, we're creating our own scary story in our head, that when the nervous system is overstimulated, overactivated, it's going to affect the endocrine system. And the endocrine system is where all the hormones comes from. So when the endocrine system is activated by that constant stress, so that means that the fight or flight response is triggered. And when the fight or flight response is triggered, basically your body is in survival mode. So your body is like, okay, let's pump up all the cortisol and put on all these like resources. So you have a high cortisol level. When your cortisol level is high, it actually suppresses your immunity. When your immunity is suppressed, that means that you're more likely to get sick. And when your immunity is suppressed long enough, that means that your normal healing process in the body is not being carried on normally or efficiently. So you start seeing a lot of autoimmune disorder. And that's really what autoimmune disorder is. When you look at the word auto, means that self, and immune is your own defense system. So the way that we often explain to our patient what autoimmune disorder is that your body is attacking itself. But the way that I interpret it is actually differently, because your body don't attack itself. The body is just falling apart. That's how I describe or interpret autoimmune disorder. Because normally our body is able to heal, right? Like my fingers. I cut my fingers all the time when I cook, but it heals, right? So our body have an um, innate healing power if we just leave it alone. Because if I cut my finger, I know that next week it is gonna heal. I don't question it. I don't like, oh my god, I cut my finger. It's not gonna heal. I better go to a doctor and get stitches. I don't, because I know that my body will heal. Or if I get a cold, like few weeks ago, I got COVID and I recovered. So we know that our body can heal. But the thing is, when you're in constant stress and your your endocrine system or your fight flight response system is constantly on high alert, so all the resources is going to the endocrine system, then your immunity is being suppressed, because right now survival is more important, because your body is sensing a life or death situation. So all the resources are going into that system right now. So things like immunity is probably not the best, because we're like, we need to make sure that you have food, we need to make sure that you have a safe shelter, and all of those things. You can get sick, but we need to make sure that you don't die the next few days. Okay? So that's how your body is thinking. So your immunity is not only about fighting disease when there's disease coming into our system. We have all kinds of defense system against that in our body. But when your immunity is suppressed, it is not healing itself. So our body, we know that our body is in a constant regenerating and destructive state. Like that's actually the true definition of metabolism. The metabolism is the whole sum of the anabolism. Okay, I got the word right. Anabolism and metabolism. Oh, no, anabolism and catabolism. Sorry, I haven't talked about those forever. So the metabolism that we often talk about is not just about how much calories we burn, it's actually the overall sum of anabolism, which is tissue building, and catabolism, tissue breaking. So our body is in a um, constant state of breaking down tissue and rebuilding. But if our immunity is suppressed, we're still having that process, but the rebuilding part is a lot slower, but the breaking down is still the same and is actually accelerated because of the activated endocrine system. So when your endocrine system is activated, there's all these like stress hormones going on because your body's like, okay, get ready now. We're expecting like trauma or expecting threats and things like that. So your body is actually using more resources, breaking down more tissue to support the life or death preparedness. But then the rebuilding part is not as much now because like it's being slowed down. So you're breaking down more tissue, but then your recovering is slower. And that's what caused the autoimmune disorder is something kind of like breaking down. But that's kind of like the functional nutrition medicine part of explaining. But then the other part about um, the mind the mind body part is this is where I learned from Marisa. It's amazing. And I'm going to tell you some story later. Okay, so with the psychological emotional part is this is the phrase that Marisa talks about a lot. It's not her original phrase, but it's a phrase that she get from another very prominent psychiatrist in England many years ago before we're all born. So he says that feelings feelings that cannot find its expression in tears will cause other organs to whip. And I was like, oh my God, that's so amazing, right? So when we have all these emotions that is built up in our body, and you know how when we're growing up, we're like, stop crying. Like we learn to suppress our emotions, right? Like when we're growing up, we're like, stop crying, stop making noise. I don't want to hear you now. So we grow up with all this um, pre-training that we're not supposed to ask for too much. We're should just keep to ourselves. We shouldn't cry even if we're upset. So a lot of women, I see, especially with women, that's the reason why I want to work with women is that that's how I learned it as a child as well too. Like I don't have a voice. No one want to listen to me. My parents don't care shit about what I say. And then I can't ask for too much. If I ask for too much, it's like, why are you asking for so much? We don't have money. Or why are you crying? There's nothing to cry about. Just stop crying, right? Rather than coming to me like, oh, why are you crying? They never validate my feelings. So we often think that when we have bad feelings, it's something wrong with us and we have to hide it. So all this bottle up feeling is just think of it, right? Like feeling is kind of like gas. It needs to come out. If it stays in, it's uncomfortable and it's gonna hurt you. So these feelings are not coming out the normal way as in tears, right? When we're sad, we cry, and then when after you cry, you feel better, right? That's your one of your body's way of releasing some of the feelings. And then, of course, other ways to relieve feelings, like some angry people just talk very angrily, they break things. That's other ways to release the feeling. But if you have all these feelings bottled up, you're not going to hit tennis ball or hit golf balls or break something or yell at someone to let that anger out. That anger, even sadness, will find some other ways to come out through your body in a physical way. It might not come out as tears. Tears probably is the best way to let your feelings come out because you just wipe it off and then you're done. But if you suppress that tears and your feeling have to come out through the skin, you could have ended up with something like eczema or even asthma or irritable bowel syndrome or diarrhea. All of those could actually be symptoms of some kind of underlying bottle up emotions that you have that needs to come out. But because you're not letting it out the normal way in form of tears, it just find another way to sip out of you. Or like even like coughing, migraine headaches, and all those things. So that's one way how that's how I kind of start looking into like the hypnotherapy and everything, because if all these emotions are bottled up and then comes out in another way, in another form of behavior, how are we going to fix that, right? Because like people with like skin problem, eczema, dermatitis, stomach pain, IBS, all of those things, if you ask them like, oh, what thing is the emotions that's causing that, they're like, I don't know. And I've been seeing a lot of people with binge eating, and they're like, I don't know why I'm eating so much, like have to I crave like all this sweet stuff, desserts, ice cream, and things like that. I just can't stop it. And when you ask them things like that, they can't find why. And I think a lot of my clients have the same issue as well. Like I just don't understand why I keep gaining weight, why I can't stop eating, why I can't go exercise every day, or why I can't do this. So you have all these questions that, or all this behavior that you consciously have no control of, right? So then Marisa started talking about like hypnosis and hypnotherapy. I was like, oh my God, that makes so much sense. So all of this are all subconscious decisions that we made as a little kid. And it got carried over into adult life, and and no one ever tells you, right? Because you go to a doctor and say, oh, I don't know what's wrong with me. I was eating fine, eating healthy stuff, exercising, but I just keep gaining weight and gaining weight. And then your doctor do all the tests, everything negative, and then they basically tell you, oh, it's in your head. Nothing's wrong with you, right? You probably hear a lot of that. Or some of you might even feel so guilty and ashamed because you're binge eating or overeating, and you know, like I should know better. I shouldn't be doing that. But you continue to do that. And then that makes you feel ashamed, and you just don't want to even talk to anyone at all. But I'm telling you today, there is a reason why you're doing that. And I learned over the last few months studying hypnotherapy, becoming a therapist, is that what we observe in a lot of people, even in addiction, where the person have no control, like they know in their head like 100% knowingly that the drugs, alcohol, and whatever they're addicted to is bad for their health, but they do it anyway. It's not because they cannot control it. Well, actually, it is because they cannot control it consciously. All of this behavior, any kind of behavior and thoughts that you have that you cannot consciously control, like how your doctor said, oh yeah, just stop eating that much, just stop eating cookies, or just start exercising more. Like we like my patient get those advice all the time, but they're like, that's but if I can just do that, I wouldn't be coming to see you, right? So they have these behaviors that is basically self-sabotaging them. Or people with depression, anxiety, and addiction have all these looping thoughts of bad things, telling themselves all this bad stuff like you're not good enough, you're a piece of shit, you're a waste of space, you don't deserve to be here, right? So all these like looping thoughts and negative self-sabotaging behavior that if you cannot consciously as yourself, your conscious self not able to control, that means that there's a deeper control under your subconscious or in your subconscious mind. And that means that your subconscious mind has a very good reason to keep that things going on, but might not be something that helps you anymore. So that's what I learned is that all this behavior that you cannot control have a subconscious cost to that. So then that's where the hypnotherapy comes in to help, is that with the hypnotherapy, you'll be able to deep, dig deep into the subconscious. You basically, this is how hypnosis is. So hypnosis is just a state of your nervous system going to sleep. So you basically in hypnosis, your conscious mind, your logical mind goes to sleep while your subconscious mind will be awake. And by the way, your subconscious mind is awake 24/7. It's like your 24/7 security system. It's constantly recording anything, everything that you hear, see, and stuff. It knows. It hears everything, records everything. except that your logical mind is blocked out from most of that. But in hypnosis, when you're in hypnosis, which is a very deep state of sleep, is like a very deep meditative state. It's not a weird thing at all like you see on TV. But the things you see on TV just show you how powerful hypnosis is. So it's not a weird thing. And you have totally under control. Like I said, hypnosis is just a very deep state of meditative state. And in that state, your subconscious mind is open up and like I said, is always available. So the story I want to tell you is like it's just amazing. I've been practicing hypnotherapy for a few months now, and it's just amazing. Like all these people will come to me and then they'll be like, I have this problem that I don't know how to fix. And I ask them, what have you tried? This, and that. And I just don't know why I can't stop eating. And every day after work, I just feel like I need to eat. And I cannot just eat a few bites of ice cream. I have to eat the whole container. I have to eat the whole bag of chips until every single chip is gone. So all of these things, right? And like all of these people, it's not like these are ignorant people. These are very smart professional people that I work with. And they just have no clue why they cannot stop eating those junk food. So in hypnosis, everything is just so easy. And I'm still very amazed at what hypnotherapy can do. Is when my patients in the hypnotic state, when the nervous system is sleeping and the conscious mind is sleeping, like you just ask them the question, what was the cause of this person's binge eating behavior and overeating? Like you just ask, and then the answer just comes up right there. So in hypnosis, what we do is once you're in the hypnosis, which takes about like 3 5 minutes to get into a hypnotic state, then I'll start asking them, okay, we're going to go back to three scenes or three memories that is the root cause of your eating problem or your autoimmune disorder or whatever problem that you come see me for. And every time I ask that question, we always automatically, their mind will come up a memory, a very distant memory, usually when they're very little, like 2 3 years old, or or 6 7 8 9 years old, of a scene where they describe some kind of relationship with food, and that's how they come up with today's problem, whether it's a poor relationship with food, binge eating, overeating, a problem with weight. But the thing is, every single one of my patients who are dealing with binge eating, they all comes up with different reasons. So like how in conventional medicine, we always tell people like if you're overeating, just stop eating. Or if you're overweight, just stop eating so much and start exercising more. But when we go back to these things that cause the problems today, none of it has to do with the extra calories that they eat or anything. It all has to do with some kind of event or things that happen in the childhood. So like um, one one of the client I worked with yesterday, I was just amazed. Like he said that every day after work, he just have to eat. He have these cravings to eat all this junk food, right? And then it came out from the regression, comes back in the regression, we came back to some scenes from his childhood. Basically, all the scenes is that his parents are super strict and doesn't allow him to eat any of those junk food. So whenever he have the opportunity, he'll eat all these junk sweets, ice cream, cookies, and candies, things like that. But because he's so afraid that the parents will find out, then he have to eat a lot of it because he cannot bring any of those home, right? So he'll eat in secrecy so the parents won't find out, and you have to eat everything and hide all the evidence so the parents won't find out. And then the other feelings that came up in that situation, not only is that he is being restricted to those foods, but he also discovered that one of the reasons why is that when he eats those food, it gives him a feeling of freedom, and it also numbs his feeling of loneliness. Because this is all him, right? It's not me putting ideas in his head. This is all from him coming with those things, and he determined it on his own. So the binge eating actually serves a purpose for him, because the binge eating and overeating for him is, it helps him to numb the feeling of loneliness, because back when he was a child he has no friends, and then now as an adult he's living alone. And then it also give him a sense of freedom, because his parents are super strict. So eating those food and hiding behind the parents give him a sense of freedom, that, oh, I can do whatever I want, right? So when we look at the back, how we come up with those beliefs is that when he was little, eating and binge eating give him a sense of freedom and also help numb his loneliness. So he carries that belief over the years since he was little until today. He's still carrying that same belief. So so the next part of the hypnotherapy is we help him understand that, oh, okay, so now you understand that why you came up with this. So you see why you don't need those beliefs anymore. So we help him reverse off those beliefs and get rid of all those beliefs. So that's one. And then another client who have like eating this, not eating disorder, more like a binge eating disorder. Her reason is she went back to memories of her, what was that? It's again a secrecy. A lot of people who binge eat do it in secret. So her is associated with love. So she eats or binge eats whenever she feels stressed, because eating candies and sweets makes her feel love. And her story was, when she was little, her parents um, got divorced, and after the dad moved out from the house, the dad will like every so often send her a box of candies and cookies and all the sweet stuff, right? So because she missed her dad so much, she kind of very treasure all those food, and she'll hide in secret, because it's something between special between her and her dad, because her brother didn't get the same treatment. So she thinks, oh my god, that's so special. So she associate all these sweets and candies and sweet stuff with love from the dad. So that's her meaning of the sweet things and overeating. So when she was growing up, she attached the feeling of love to all these sweets and candy. And then she eats in secrecy. Every time she feels sad and upset, she'll go to her stash. So she hide that candy from her mom and her brother. So she's the only one who have access to it. And she just eat a little bit at a time, savoring that feeling of being loved by her dad, that little secret that she and her dad has. So as she get older, she continued to attach that feeling of being loved with the dad, or that special love, like, oh, I'm so special. My dad always sent me this. So every time she has anything that's stressful, unhappy, she goes to sweets. So she ended up binging on those, and that's her cause. And then now knowing that she knowing that the cause of her binge eating is that she's associating candy and sweets with love, and she's like, you know what? I'm a grown up adult woman now. I don't need that anymore. So we do something called It's Not Me. So you go back to the scene and say, okay, it's not me anymore. I'm a grown up adult. I don't need the love from my dad. I don't need to hide in a corner to eat candies or stuff. I can eat candy whenever I want. I can eat just a little bit and put the rest and eat it for later or throw it away. I don't need to hide everything. And it's the same with the other client that I have. We just tell them, explain to them that that's not you anymore. And then they're the one who realize that, okay, I don't need to feel lonely anymore, or I don't need food to fill my emptiness. I don't need food to fill my insecurity, or I don't need food to do this. And that's a few examples. And I was just amazed like how hypnotherapy is working. Like even though when a lot of my patients who have autoimmune disorders or weight issues, body image issue, has gone to all kinds of specialists, tried all different kind of diet, keto, paleo, whatever, nothing helps. Well, some of it do help, but they just cannot continue that process. And when all of this all boils down to something inside you, like inside you up here. And I just thought that was really amazing. So And I'm really happy and excited that I'm able to know all of that and be able to help people actually solve a problem that is just so frustrating. Like, just imagine having a condition that no one can help, and every doctor just tell you everything is fine, all the blood tests is normal, like it's all in your head. Yeah, they're kind of right? If we have some kind of belief system like I just described, it's in your head, but no one can help you. But I'll have to say that hypnotherapy is a really good tool as part of the nutrition therapy as well. So that's something that I'm very grateful and happy that I can help people with a combination of functional nutrition therapy and also hypnotherapy. So yeah, so I guess that's my story, and hopefully there will be more happy endings to share. So this is the first episode, and it's called From the Very Beginning. So that's my story, how I get started, and I hope that it inspires some of you. And if you have any question for future episode, so there'll be more of these episodes coming up, and I'll see if I'm going to do a lesson plan or start inviting guests. Or if you're someone in the same like therapy space, give me and send me a message, and then we can talk, and maybe we can collaborate on some future topics together, because we just need to get this message out, because there's so many people suffering and just sitting in the dark, and no one is telling them that, hey, there is a solution. You don't need to suffer. Because I've seen so many overweight women just have given up. It's like, you know what? I tried everything under the sun, and I have don't know what's wrong with me. The doctor don't know what's wrong with me. But I'm telling you, there is a solution. And conventional medicine, conventional therapy does not work. If those doesn't work for you, you should give a hypnotherapy a try. So you can give me a call or message me here. But anyway, very nice talking to everyone on Instagram and on Facebook page. Um, yeah, so that's it. And I'll talk to you all again next week. Okay, bye.